Hi, my name is Letizia. In today's episode, we invited Harris Palaondas, the business director of SofMedica Life-Saving Innovation Group, to talk about the future of health and how technology is changing medicine. Hope you enjoy. Hi, Harris. It's really nice having you here. Thank you so much for being on our podcast.
Thank you for the invitation, Leticia. It's great to be here.
Can you start by telling us a bit about your role in the medical device industry and what is the company that is providing innovative medical technologies in the healthcare industry as of right now?
Thank you for this question. I'm just a lucky person who gets to work with a great team, and our mission is to make sure that the remotest patient in New Europe, as we call our region, which is the Southeastern Europe, to have access to innovative medical technologies. That's what we strive for every day. So basically, lead a team of people who are clinically oriented, and we promote medical devices, innovative medical devices, to hospitals and to physicians. Beyond that, we ensure that we train these physicians so that they have the required proficiency to operate these innovative technologies. Beyond that, hopefully we believe that we are contributors in the healthcare system by providing access to patients to these technologies, and also by helping the market understand their value through data.
Thank you so much. That's amazing to hear. So, medical technology is currently evolving, as you've just mentioned. And can you share some innovation medtech advancements that have made a big impact on us, on people? Yeah.
Sure. I'll talk about the quadruple aim that is the main focus in healthcare, which means it's 4 different objectives: better patient outcomes, better patient experience, better healthcare professional experience, and overall lower cost for the healthcare industry. And with that quadruple aim, the technologies that are coming out nowadays to meet that demand, it's robotics, non-invasive procedures, so that means there's no scars or intervention made to the human body or skull. And beyond that, we have the artificial intelligence, which assists a lot at this moment in the diagnostic part. So what we are also proudly promoting is robotic surgery, which is basically minimally invasive surgery that assists surgeons to provide better outcomes, better reach, better visualization. And robotic surgery is quite well developed nowadays. So there are more than 7,000 robotic systems worldwide. So there's more than 10 million robotic procedures have happened to date. And there are more than 60,000 surgeons trained today. So we are very proud that in our region we managed to develop these programs. We have around 50 programs today in our region, where we have made sure they developed a program that sustainably works for many years, providing access to patients to better surgery and better surgery outcomes. Another technology that is also we're seeing that is going to be the future is non-invasive. It's the power of sound and light. So I'll give you an example. We are recently promoting a new technology that is non-invasive for treating ancestral tremor and Parkinson's-related tremor. It's also going to bring indications for the whole Parkinson's, and in the future, Alzheimer, dementia, glioblastoma, and many other brain dysfunctions and diseases that have never been properly treated so far, where medication was the only solution. So what this technology is offering is for patients that are refractory to medication, with simply a 2-hour process under the MRI without anesthesia, with the use of ultrasound waves and beams, there is a lesion made in the hypothalamus of the brain. That lesion is, of course, non-reversible, but it allows the patient's tremor to stop. So this technology, it's called MR-guided focused ultrasound. So check it out when you have the opportunity.
It's so interesting. I never heard of this before, but I'm sure it will help so many people in the future. So, can you tell us more about the robotic procedures that you've mentioned previously? Like, what are the types of robots that you and your company provide, or can you say that?
Of course, yes, sure. Robotic surgery for us is Da Vinci surgery, where we have developed more than 50 Da Vinci programs in the region. So the first system that we installed was back in 2002. So last year we celebrated 20 years of robotic surgery in the region. It's the fourth generation of systems now that incorporates data collection, simulation, advanced instrumentation, a Firefly mode, which basically it's a way of coloring the vascularization when the surgeon looks inside the surgical field, and many other additional technologies, mainly around the software that it's evolving each technology. So the robot typically has 4 arms. So the surgeon has 2 arms. So now you have a 4-arm capability, one that holds the endoscope, the camera, and the other 4 using very intuitive 7 degrees of freedom instruments, so they can reach very low in the pelvic area or upper in the abdominal area. This robot is used for urological, gynecological, general surgery, thoracic surgery, some pediatric surgery, but also TORS, meaning transoral procedures for the mouth and the neck. It treats cancer, both malignant and benign, but it's also used for other benign type of procedures. This is it in a nutshell. So the robot, basically, it's split in 3 parts. You have the surgeon's console, where the surgeon sits and looks on a 3D 10 times magnification picture and guides the robot, which is on what we call the patient cart, which is above the patient, in the sterile field. So the surgeon, this time, it's outside of the sterile field. So the surgeon doesn't even have to sterilize or wash his hands. So the robot is in the sterile field together with a scrub nurse next to it. And it operates inside the patient. And that's what the surgeon looks for. What are the advantages? Faster recovery, almost bloodless surgeries, so no use of, very limited use of extra blood for the patient, blood transfusion that is. Very few re-interventions happening, and of course, an overall improvement of the cost of surgery. This is it in a nutshell.
Thank you so much. It actually is really interesting, and thank you so much for sharing this. So, as we all know, the COVID-19 pandemic has changed the world a lot, tremendously actually. So how has it affected the use of technology in the medical device industry?
That's a great question. COVID really gave healthcare a boost. It has prioritized healthcare versus other governmental directions. So healthcare immediately from one day to the other became more important. More funding went into healthcare, which means that instantly there was the ability from countries, public and private sectors, to invest in innovation. Why innovation? Because it reduces, basically the cost meets the quadruple aim that we discussed in the beginning, and also assures that there is a way of managing diseases from a distance. So not too much human interaction into the whole process. So this understanding of how important healthcare is, there was a flooding of money, both into existing innovative technology, but also startups. So a lot of startups received funding for developing technologies. The good news is that this funding continues to exist. So during COVID, we have seen flourishing of startups not delivering, but actually designing medical devices. How many of these will actually reach the hospitals and the patients? That is a question mark. It depends on their clinical studies, their success rate, but also the continuation of funding. And new technology, medical technology, from inception to commercialization, we're talking a period of around 10 years.
Wow.
Yes. Hopefully in the future, with quantum computing and more AI and data, the concept is to reduce this cycle. So bring these technologies much earlier to the hospitals and to the patients.
Thank you so much. So, as high school students, we're obviously very interested about the technological part of the medical device industry. So what advice would you give for fellow high school students that are watching or listening to this podcast that are trying to or want to go into this industry after finishing college?
That's a great question. Study well and hard and work hard. I can't give any other advice in this moment. So if you want to go in this field, definitely you need to look into engineering. Engineering and coding is what is going to shape the future of medical technology. So if you're looking for a direction, that's the direction you should be looking for, but it takes hard work and dedication.
Thank you so much. I'm sure they're going to appreciate this advice and look more into this. So the medical device industry relies a lot on a multidisciplinary approach, right? Mm-hmm. So can you tell us about the diverse roles and expertise needed in your company?
Thanks for this question. So in our company, we need really good clinical sales specialists, as we call them. So basically, it's a combination of understanding clinically how the technology works. Usually, their background is biomedical engineering, but not always the case. And they need to have an acumen towards sales, because at the end of the day, you need to understand how to sell these technologies, how to add the value and sell an ecosystem to the hospitals. Beyond that, we require a lot of technical skills. So devices require service and maintenance. So we need to have good technicians that we constantly train and keep them up to date. In our field, the rest of the team is more into the economic side of things. So there's a bit of finance, a bit of marketing, and of course management and leadership.
Thank you. So, as many people might know, innovation often involves taking risks. So, can you share a story of a time when your company took a risk and what was the outcome, if it was a positive one?
Yeah. Walk down to memory lane. Sure. I mean, we've always encouraged incubating new technologies. So we've taken risks on bringing technologies even before we felt the commercial end of the story, how to sell them and what the total potential will be. We've taken the risk because we've seen some great ideas of approaching patients that were in need of that technology. So one of them was a pain monitoring device. So as you know, patients, when they undergo surgery, when they're under anesthesia, you can't really tell how much pain they're feeling, but there is pain. So usually anesthesiologists would just provide enough opium type of anesthesia to keep them under anesthesia during the duration of the surgery. But if you give too much anesthesia, there is a problem that people get opium. What's the correct word? They get accustomed to opium, which is not good for their health. It's like a dependency. If you give too little, then the patient wakes up in pain, the recovery is longer, and there is issues of chronic pain. So patients, even after they recover from surgery, they have chronic pain for many years. So the study of pain management is actually a new study in medicine, but there was not enough devices around it to actually measure this. So we discovered this very interesting technology made in Israel called MedSense, and that exactly tried to measure using an algorithm, a very smart algorithm that developed itself, so kind of an IA, to measure the levels of pain. So that would give immediately an indication to anesthesiologists how much anesthesia to give to the patient. So that when the patient wakes up, You make sure the patient is not opium addicted. That was the word I was looking for. And there's no chronic pain. So waking up at the right time, faster recovery. So why we took a risk? We took a risk, and it's been now 3 years. The market still didn't understand the value of this into the whole chain. Also, we have seen it in Europe. It wasn't very, very well understood because there are, when you're trying to split the budget and certain costs, you have to decide where you would allocate them. But we're still very proud that we gave it a go. And just like this technology, that is just an example, each year we are incubating at least 2 to 3 new technologies, taking the risk whether they would work commercially or not. Manageable risk, but we're very proud of doing that.
It's amazing to hear because it just shows that taking risks can lead to something really amazing. So what do you find most rewarding about working in the medical device industry?
That's a great question. Actually, it gives me a purpose. When you wake up in the morning and you want to go to work, you say, why am I getting out of bed today? What for? When you're working in medical devices and generally in the healthcare industry, you work for a bigger purpose. And you get to sense that when people within your family or yourself have to undergo one of these procedures. So basically, I am a robotic surgery patient. So I have been treated with one of our technologies, and I have seen the benefits real time. So really working for the healthcare industry really makes me proud, and I'm very happy to share this. When I shake hands with people, I say, "What do you do?" I work in the healthcare industry. When you find a job that leads to a bigger purpose, it really fills your life and really gives you motivation to do it. And this is why I work in the healthcare industry.
It's really amazing to hear, and I'm sure this is also going to motivate a lot of young kids around the world to pursue this career.
Sincerely hope so.
So now that we have reached the end of our podcast, I have one more question for you.
Please.
So what exciting technological advancements do you see in the future, and how do you feel like they're going to change the medical device industry?
Right. Great question. How much time do I have to answer this? I'll try to keep it simple. So the future is keeping patients out of the hospital. That's one part of the future, meaning preventive diagnosis, meaning at the end of the day, implants that will measure all our body dynamics and immediately transmit them to the right facility or physician to deal in case there is a disruption or a problem. Today we have the so-called Apple Watches or the rings that monitor some of the parameters of the body. In the future, and this technology actually exists today, but it's just not commercially available yet. Hence, you see a lot of investments by Apple, Google into healthcare. Is making sure that people are monitored before they become patients. And by keeping people out of hospitals, you reduce the cost of healthcare immensely. So diverting funds into investing in these technologies, and for example, big incubators like the US, they're allowing the private market to do it. More socialist, communist countries like China, the state is investing massively into this. So we're going to see one part is going to be keeping people out of hospitals. So preventive, I can't say maintenance, preventive medications, okay? Then we're going to see customized pharmaceutical solutions, meaning for each person, each individual is different. Different cells creating cancer or different the reaction of the organism to different stress parameters and so forth. So each individual is different. I believe in the future we're going to see the rise of customized medication that will be very well targeted for the individual or a group of individuals. It's already happening for larger groups, for their type of DNA category in their cells, but this is going to go stream down into the individual. Then we're going to see technology into the diagnostics, like artificial intelligence. Artificial intelligence will speed up things a lot, so you won't need the human eye and brain to process large numbers of diagnostic images. You'll have artificial intelligence doing that. And I mean, the first one that's been out for some years now was IBM Watson, that they have invested in basically getting therapies, consultation for cancer patients. And what they did is that they gathered data from around the world, and by using IBM Watson, you could actually get a diagnosis and a consultation of the top 10 physicians, oncologists worldwide.
Wow.
Just by the power of AI. It didn't fly, to be honest with you, but it needs a lot of improvements, but that's a category where AI is going to help more. Beyond this, you're going to have robotics in the hospital starting to take a lot of activities from the healthcare professionals. The healthcare professionals will still have a role in monitoring, calibrating, adjusting the robotic systems until the robotic systems will be collaborating with the surgeons. Now the surgeon manages the robotic system. Step 2 would be the surgeon will collaborate with the robotic system or any other physician that will be using the robotic system. And the stage 3, you will have robotic systems that will just be supervised by a physician. What does that mean for the for doctors in the future? It's going to be a whole different area and industry. So the specialization will be different. Definitely more digital knowledge will be required. A lot of specialties will disappear. Other specialties may appear due to the technology rising. However, technology is more precise. It doesn't allow room for mistakes. Doesn't get tired. So you can imagine if a surgeon does 5 or 6 surgeries in a day, the 6th surgery, just by definition, he's going to be tired and he's risking his results. He won't have the same results as the surgery he did in the morning. A robot doesn't have this problem. So better patient results means less healthcare cost. And last but not least, just to round it up, quantum computing will help everything become faster and more efficient. And AI will come together with robotics and quantum computing to bring the ultimate efficiency into healthcare, which means reducing the costs of providing healthcare to patients. This will help national systems to be able to cope with the aging population. That is the biggest issue that the world is facing today, the aging population. And healthcare is directly linked to treating the aging population. This is in a nutshell. I hope I didn't complicate it too much.
No, it was very easy to understand. So thank you so much. That's extremely interesting. And thank you so much once again for being on our podcast.
Yeah, my pleasure. It was great. I had fun actually doing this podcast with you. Thank you, Leticia.
I'm glad.
Thank you.